and welcome to Creighton University's April educational event. My name is LaShawn Johnson. I'm a faculty in Creighton MPH's program, and I'm the assistant director of Creighton at Highlander, Creighton University at Highlander Space. Our director, Cindy Costanzo, is also here with us today. On behalf of the Creighton University at Highlander team, I would like to say that we're really happy you've chosen to spend your lunch with us today, and I'm hopeful that the time that you spend with us, you come away with information you can use in the community with your community partners. Before I begin, I want to pause to acknowledge that the Omaha, Lakota, and other tribal communities that have cared for this land throughout the generations. We thank them for their perseverance in protecting the land and to endeavor to uphold our responsibilities to this land and according to their example. I'd also like to say that we are cognizant that we cannot separate the history of our university or our community from the history of colonialism and slavery in the United States. We acknowledge the legacy of slavery in this area and the blood, sweat, and tears of enslaved people that soaked the earth beneath our feet in Omaha. The legacy persists today as we continue to work towards racial justice and equity in Omaha. So before I turn it over to Kiara, I just wanted to do a few housekeeping things. I want to just remind you, in case you've not joined us before, we ask you to put yourself on mute if you're not speaking. We encourage you to use the chat to ask questions throughout the presentation. And it's up to you. You can decide if you want to share your camera or not. We love seeing your face when you're asking a question, but we understand that this is your lunch hour. So if you're eating lunch or other things going on in the background, please feel comfortable with not sharing your camera. So over the past year, we've tried to be intentional about shifting our focus to one that's more geared towards growing in our work for racial and social justice, approaching our neighbors with an asset and trauma-informed lens, and really understanding our partners with the fullness that stretches beyond the needs of the university. With that in mind, we're always thinking about the tools we can employ to help community members and the Creighton community work together to make more smooth partnerships. So the work of the Highlander has always been wellness focused, and we've been talking about for a while the importance of health literacy. So that's why we were really excited when we met with Kiara and she mentioned she was interested in working with us and doing a presentation. So as you see on the screen, her presentation is about health literacy and effective health communication. So a little bit about Kiara. She is the Education and Outreach Coordinator for the Health Sciences Library, funded under a grant from the network of the National Library of Medicine. That's a handful, I can't get it out. She earned her Master's of Library and Information Science degree from the University of Missouri. I also went to Mizzou. And prior to becoming a librarian, she worked in the healthcare field for 9 years. She's a junior board member of the ICON Library Consortium, a member of the Medical Library Association, and the Mid-Continental Chamber of Medical Library Association, where she serves on its advocacy community. Again, I just want to say how grateful to everyone who's joined us and to remind you that we are recording so that we can share this important tutorial with students and faculty and community members who were not able to join us today. So without further ado, I'm going to turn it over to you, Kiara. Thank you so much for taking your time to share with us. Thank you for being so generous with your ideas and the information you're going to share today. And thank you all for coming.
Thank you, Dr. Johnson. So today I'm going to discuss health literacy and effective health communication. Things I'm going to discuss today are what health literacy is and the different components it entails, discuss risk factors of low health literacy, show you how to evaluate and identify reliable health information resources, discuss Medline Plus as a reliable health information tool that you can use, and discuss how to effectively communicate with patients using the teach back method and using plain language materials. So first we'll discuss what health literacy is. Health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information that they can use to make appropriate healthcare decisions. Now, when you break this down, the first part of health literacy, or the first capacity, is to obtain or find information. And you may think that this is very easy to do. You can just type your health query in Google and you get all of this information. But that's where it becomes difficult sometimes because there is so much information. We need to be able to determine what is the reliable, accurate information. The next part of health literacy is the capacity to communicate, which is the ability to communicate and share information with one another. When we discuss a health issue or create a written health message, we're communicating. And communication skills equip providers and receivers, or patients and doctors, to be able to ask questions, clarify misunderstandings, share their health history, and pass on information about health behaviors, symptoms, different diagnoses, and really anything that impacts health. And when the ability to communicate is diminished, there's a good chance that health literacy will be diminished as well. We also have to discuss the capacity to process or evaluate information. We have to be able to determine if the information is trustworthy or relevant. And providers need to be able to evaluate the information that they are giving to their patients for accuracy and bias, and for how appropriate the information is for their target audience, both in terms of relevancy and how well matched it is to the patient's ability to read and understand the material. Then there's the capacity to understand. If you're finding information for yourself, you'll need to understand it in order to use it. And if you're finding information for others, it needs to be presented in a way that they can understand. Similarly, if a person receives treatment and those instructions are not useful to them, that also makes it more difficult for them to be health literate. And finally, we have to ensure that understanding is a shared responsibility and that we can communicate well with each other. And then lastly, I want to mention that health literacy is about applying the above capacities into action. In other words, using health information to manage care or make decisions regarding health. The focus on this current definition is to make health literacy as an action-oriented concept rather than an intellectual capacity. The outcome of proficient health literacy is the ability to make informed decisions about health. There are different components to health literacy, and they are personal health literacy, organizational health literacy, digital health literacy, and numeracy. And I will discuss each of those individually. First, personal health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions for themselves or others. Examples of this include understanding prescription drug instructions, understanding doctors' consent forms, and the ability to navigate a complex healthcare system. Organizational health literacy is the degree to which an organization can equitably enable individuals to find, understand, and use health information. And examples of that include being able to simplify the process to schedule appointments, using the teach back method to ensure the patient comprehends what you're telling them, and providing communication in a language, reading level, and format that is appropriate for the patient. Digital health literacy is the ability to seek, find, understand, and appraise health information from electronic resources. And examples of this include being able to access your electronic health record, being able to communicate with your health team electronically, an ability to discern online health information, and being able to use health and wellness apps. Lastly, there's numeracy, which is the ability to understand and work with numbers. Examples of this include understanding nutrition information, being able to interpret blood sugar readings, taking the correct dosage of medication, and evaluating treatment benefits and risks, as well as understanding insurance costs and coverage. Low health literacy skills are common, with nearly 9 in 10 adults struggling with low health literacy. When someone has low health literacy skills, it's also often due to factors outside of their control. And we have to address these factors in order to improve health literacy skills. Research has shown that people with lower incomes or educational levels, people with health problems, older adults, non-native English speakers, and people in underrepresented groups are more likely to experience limited health literacy skills. But it's also important to remember that health literacy affects everyone. Even people with high health literacy skills can have low health literacy skills at some point. And this could be if they are ill and they're trying to access information, they may not be able to remember, understand, or use that information. Low health literacy affects all segments of society. However, several factors are associated with higher rates of low health literacy. The epidemiology on health literacy shows that adults living below the poverty line are more likely to have lower health literacy than adults living above the poverty line. There are many socioeconomic variables that are associated with lower health literacy. Insurance status is one example. Uninsured adults are more likely to have low health literacy than those with insurance. Individuals with chronic illness are also more likely to have low health literacy. Disability is also a risk factor in low health literacy. In particular, if a person has hearing, speech, or visual impairment, or they have a learning, mental, or emotional disability. This can impact how you communicate with your patient. Age is another risk factor. Adults over the age of 65 have a higher rate of lower health literacy than adults under the age of 65. However, amongst older adults, health literacy levels vary by education level and access to financial resources. In fact, education mediates other risk factors in adults of all ages. Identifying as a racial or ethnic minority and speaking English as a non-primary language are also risk factors. Some of the greatest disparities in health literacy occur among racial and ethnic minority groups. Cultural differences and language barriers impact communication and understanding. Belief systems and customs impact response to health information, which also impact health literacy. People without a high school degree or GED also have higher rates of low health literacy. Often low education is associated with low print literacy. And by low print literacy, I mean reading, writing, and number skills. Low print literacy is not a prerequisite for low health literacy. Someone can have average or above average reading level and still have low health literacy. If a patient receives printed health communication materials that are above their reading level, patient education is not going to be as effective. There's less of a chance of a person understanding the message that you're trying to convey. Of course, all of these factors intersect. The Institute of Medicine Committee on Health Literacy says an individual's health literacy capacity is mediated by education, and its adequacy is affected by culture, language, and the characteristics of health-related settings. So what are the effects of low health literacy? People with low health literacy are more likely to visit the ER and more likely to have hospital stays. One study showed that they are not only more likely to visit the ER, but they're also more likely to return within 2 weeks, which makes sense because health literacy impacts one's ability to understand discharge instructions. People with low health literacy are also less likely to follow treatment plans. Low health literacy can act as a barrier for effective disease self-management, and this is especially true for people who have chronic conditions that require complicated self-care regimens. People with limited health literacy are also more likely to skip needed tests and underuse preventative health care. They may also have trouble understanding information in a health news article. So now that we've discussed what health literacy is and its risk factors, I will now discuss steps that you can take when evaluating resources for trusted health information. So we want to look for currency, relevance, authority, accuracy, and purpose. When you put this together, it's called the CRAP test, which is how you critically evaluate information. So for currency, we're looking at timeliness of information, relevance, the importance of the information for your needs, the authority, which is the source of information, the accuracy, which is the reliability, trustworthiness, and the content, the correctness of the content, and the purpose, which why does this resource exist? So first you want to look at currency. You want to look at when the information was written, published, or updated, and ask if the resource list that the information resource list the date that the information was updated. If you look at a resource and you see that the information is 5, 10 years old or even older, that might not be a resource that you want to use. You also want to make sure that if there's references that they're not old, and you want to make sure that the website that you're looking at has links to other websites that work. If there's a lot of broken links, you won't want to use that website. You'll also want to check for relevance. Does the information answer the question that you have? And who was the information written for? Is it written for the general public, or is it written for medical professionals? And have you looked at other sources before choosing this particular one? Did you do a Google search and just click the first thing that came up, or did you evaluate other resources before deciding on which one would best suit your needs? You also want to think about the authority. Who wrote the information, and what are their credentials? Are they qualified to tell you about a topic? When you're looking at a website, you can see if the website ends in a .gov, which is a government-sponsored site. Is it an .edu, which is an educational institution? Is it a .org for a non-commercial organization, or a .com for a commercial organization? And is there information about the organization published on the website? Can you easily find who they are and what they are about? You always want to look at the About Us section of a website. That will give you good indicators of who runs the website. If there's no About Us section and the information is difficult to find, that might be a resource that you want to pass on. Then you want to look at accuracy. Who's providing that information? Is the information supported by evidence? Can you find the information on another authoritative resource? And has the information been reviewed by scholars that are knowledgeable on the topic that you're looking at? You also want to see if there are any spelling or grammatical errors. That is another indication that you do not want to use that resource. Lastly, you want to look at the purpose. Why was this written? Is this website used to inform and teach, or to sell, entertain, or persuade the user? Do the authors or sponsors make their intentions or purpose clear? Is the information fact, opinion, or propaganda? And does the points of view seem impartial? One thing to think about is if the website is trying to sell you something. If you're going to a website for health information and you're seeing ads with new medications that they're trying to promote, that might be a reason to not use that source. And if an organization or website wants to use your personal information, you want to be aware of why they want it and how they want to use it. So once you put all of these elements together, it will be easier to identify reliable health information resources. One tool that I like to use is called Trust It or Trash It, which is available on trustedortrashit.org. This is a tool to help you think critically about the quality of health information. You can click on who said it, when did they say it, and how did they know. And this is a good way to be able to evaluate information. An example being, if you click on who said it, if the author's name is easy to find, there's information about them, and they're respected in their community and knowledgeable about the subject, you can think about using that resource. If you cannot find the author's name, there's no background information about the author, you can think about trashing that resource and looking for another. So you may have come across patients who have used Google for health information, and 72% of users in 2012 reported that they used the internet to look up health information. And there are some positives in doing this. Being educated in this way can make someone feel more empowered and increase their self-efficacy. However, as we have talked about earlier, there's a wide variety of information out there. And with that comes a variation in accuracy of the materials that people are coming across online. And with this comes the need, again, for digital health literacy, which, just to reiterate, is someone's ability to select trustworthy resources when they are searching online. With some people having a limited understanding of information resources or an ability to navigate what they find online, it is especially important for patients to know where they can go for reliable health information. Literature highlights that those with higher digital literacy are more likely to get positive benefits of looking at health information. And one of those tools we can use is Medline Plus. Medline Plus is a resource from the National Library of Medicine. It is their main consumer health portal, and here patients will only find trusted resources. It's common for members of the general public to search for health information online, but it can be hard for them to know which reputable sources to use. And we talked about one feature of health literacy being the ability to find, evaluate, and understand health information. Medline Plus is one way your patient or a consumer can do this. Medline Plus only links to reliable, trusted sources of health information, so it takes away the guesswork for consumers. Medline Plus has information on over 1,000 health topics, including medications, lab tests, and health concerns of demographic groups. The entire website is available in both English and Spanish. There are easy-to-read materials written in a 5th to 8th grade language, and there are multilingual materials available in over 40 languages. When we talk about Medline Plus quality guidelines, the National Library of Medicine is not creating all of the content that you are finding on Medline Plus, but it is ensuring that all of it is trustworthy. And you may ask, how do they decide this? They have a set of quality guidelines, and some of these guidelines include that the source provides accurate, science-based information that is easy to use. There is a preference given to resources that do not provide advertising. The availability and maintenance of the page are also taken into consideration. Now I will discuss communication and how you can use communication to properly communicate with your patients. One thing you want to think about is health literacy universal precautions. One of the hallmarks of health literacy best practices is applying universal precautions for health literacy to health communications. The idea behind universal precautions for health literacy is that we should be able to communicate in a way that anyone can understand. And to do this, we need to be as clear as possible. We know that everyone is at risk for misunderstanding. According to some measures, only 10% of adults have the skills needed to use health information, and that is routinely available to us. Applying universal precautions benefits everyone. Research shows that interventions designed for people with limited health literacy also benefit those with strong health literacy skills. When information is clear and easy to act on, people feel more involved in their healthcare and are more likely to follow through on their treatment plans or enact health behaviors. So our goal is clear health communication. We want to be able to communicate as clearly as possible to our patients. On the left-hand column, you'll see what we want to achieve, and on the right-hand column, you'll see what we want to avoid. First, we want to use plain language. To do this, you need to choose common words that you would use to explain medical information to a family or friend. You want to avoid medical terminology or jargon that may be hard for a patient to understand. For example, you could say stomach or belly instead of abdomen, or you could say skin infection instead of cellulitis. Other examples are eat less salt instead of reduce sodium intake. You also want to use words that create images that people can visualize. For example, you could say runny nose instead of excess mucus. Next, you want to use simple messages, not complex ones. Keep messages concise and to the point. You also want to limit the information you provide to need to know versus nice to know. Sometimes you may feel compelled to explain more to your patient than they can comprehend. With need to know, your goal is taking 3 to 5 items and chunking them. So you're giving the patient the most important topics that they need to know. For clear communication, anticipate misunderstanding and confirm understanding. Oftentimes, we assume that the receiver understands our message because they don't speak up, and our language infers that they understand. We need to clarify when there's a misunderstanding. Oftentimes, we just repeat the same thing, but clarifying entails using different language to clear up any misunderstandings. Lastly, use objective-free judgment or objective judgment-free language. Oftentimes, we inadvertently shame people when we talk about health behaviors. An example is when we use the term non-compliant. Instead of saying, okay, I see you've been non-compliant, you could say, okay, I see here you haven't been taking your medication a full 30 minutes before you eat. That's objective. Facts in this instance, maybe you got from the patient, so there's no disagreement. And by communicating clearly, you can help your patients understand health information and the services you provide. So there are many words that we don't think of as medical jargon, but they might not be understood by everyone. And a few examples are if you tell your patient, oh, you need to see a cardiologist. They may not know what that is. You could relay heart doctor, or you have to go to the see a pulmonologist. Instead, you could say lung doctor, or maybe if you're using anti-inflammatory, you could say a drug that reduces pain and swelling. Or a PRN, you could say nurse, or benign would be non-harmful. Below are just a couple of resources that I find really useful when promoting plain language. One is Everyday Words for Public Health Communication, and that's provided by the CDC. And the other is Plain Language for Thesaurus for Health Communications. And that resource goes a little bit more in depth than the first one, but they're both great in giving you options for plain language words to communicate to your patients. Just a couple of other examples of plain language. Like was mentioned earlier, you could say eat less salt instead of reduce sodium intake. You could also say do not eat or drink before taking this medication instead of take this medication on an empty stomach. When you're looking at these words, and literally a patient may be confused of on an empty stomach. What does that really mean? And empty of what? Food or drink. So the plain language version makes it clear exactly what is meant. When you're looking for print communication, either creating it yourself or looking for it, you want to think about readability. How easy or not easy is it to read? And also use plain language. You want to make sure that it's in a writing that people can understand and that it ensures that readers grasp the message the first time they read it. So a few plain language principles. You want to use familiar terms, not jargon. You want to chunk that information into that 3 or 5 important things that the patient must know. You want to organize your information logically and write in a conversational voice. And this is just an example of subheadings and chunking where you want to take that 3 to 5 items. And if there are more than that, the list need to be partitioned into smaller chunks so that the patient will be able to understand the material better. You can also use visual aids for communication. Visuals such as pictures, drawings, charts, graphs, and diagrams can be an effective way to convey information to patients because they fill in where words may not be understood. Visuals shouldn't be used in place of text because people can interpret visuals just as they do words in different ways. What visuals do is enhance text and help reinforce written or oral instructions. And I'll just go over a few tips for using visuals in health communication more effectively. You want to be able to concentrate on the main message. Think about what action you want the person to take and use images that provide visual clues. You want to use clear heading labels and captions. You want to be able to reduce the amount of reading, but also be clear about what the image is there for. You also want to use simple, realistic pictures. Research into the effectiveness of visuals in health communication has shown that when illustrating a medical concept, simple line drawings are most effective. We also want to keep in mind that there are variations in the interpretation of standard images. Sometimes these reflect differences in the symbolism that prevails in different cultures. An example being an owl in some cultures represents wisdom, but an owl in other cultures may represent death. So we want to be aware of how we're using those visuals. A resource that you could use is the USP Pictograms Library. These pictograms are standardized graphic images, and they are used to convey instructions, precautions, and warnings. And it's common to see them on medication labels. For people with low health literacy and for non-native English speakers, these pictograms are particularly helpful in passing health information. And this is a free resource that I just wanted to make everyone aware of. And when we're speaking to our patients, we want to listen carefully. You don't want to interrupt people when they are talking, and you want to pay attention and be responsive to the issues they raise and the questions they ask. You want to use the patient's words. Take note of the words that your patient uses to describe their illness and use them in your conversation. You want to slow down. You want to speak clearly and at a moderate pace. You want to limit and repeat content. As we talked about before, we want to use the need to know method versus want to know. You want to be specific and concrete. You don't want to use vague and subjective terms that can be interpreted in different ways. You want to show graphics. As we just talked about, visuals and written communication materials are important because they can support verbal communication by filling in for any misunderstandings. And we want to demonstrate how it's done. Whether doing exercises or taking medicine, a demonstration of how something may help clear up a verbal explanation. We also want to invite questions. When you say to someone, "Do you have any questions?" it's easy for them to say no. There are many reasons. They may be embarrassed that they don't understand, they may be shy, or they may not even realize that they need clarification on something. And you can invite questions simply by asking, "What questions do you have?" This implies that there will be questions, and it encourages your patient to ask questions for clarification on anything that they don't fully understand. And then you can assess understanding. When you ask, "Do you understand?" it's very easy for someone to say yes. Lots of times people don't want to show that they don't understand or that they don't know what you're talking about. And asking, "Do you understand?" implies that they should understand. And instead, one tool you can use is the teach back method. The teach back method is a method to ensure that health information is communicated so that the receiver understands the provider clearly. And sometimes we can get so wrapped up in developing the message that we might not realize that information isn't being received. And the way to do the teach back method is chunk that information, those 3 to 5 important key notes that the patient needs, and tell them to relay that message back, relay that information back to you. If they relay it back to you and you still don't feel like they understand what you're trying to say, you can use different words and have them teach it back to you again. So you want to make sure that you and the patient are on the same page. So with the teach back method, you are taking responsibility for communicating clearly. It's not a test for the receiver. You want to normalize the process so the receiver does not feel singled out. So when you talk to them. You want to ask, am I being clear of what I'm asking of you? Another good resource is Ask Me 3. And Ask Me 3 is a program created by the Partnership for Clear Health Communication to promote clear communication between healthcare providers and patients. Ask Me 3 suggests 3 questions that assist in improving communication between patients and healthcare providers. And those are, what is my main problem? What do I need to do? And why is it important for me to do this? Another thing we need to be aware of when communicating with patients is using culturally aware communication. Reducing language barriers is a key piece of improving health communication for minority groups. But to fully address miscommunications that contribute to disparities in health literacy, we must address cultural barriers to effective communication. Here are some tips for raising cultural awareness and improving cross-cultural communication. First, you want to tailor messages to specific groups. If you're working with or creating written communication materials for people from cultures different from your own, learn as much as you can about that culture. Be aware of cultural norms and customs that influence communication, decision-making, health beliefs, and behaviors. The interplay between culture and health is complex and influences how a person thinks and feels about their health, how they respond to recommendations for lifestyle changes or treatment, and how they respond to changes in health status and health outcomes. We want to avoid,
Kiara?
oh yes.
So we have a question in the chat connected to this. Would you like us to do it now, or do you want us to do it later?
Absolutely.
Okay,
Yeah.
sorry, I just didn't know.
No, go, yeah,
So,
absolutely.
April had a question in the chat connected to this culturally aware part of it. And she said, would it be an advantage or disadvantage to mirror the language that the patient is using? I think it would help them understand, but in some cases it might seem like you are disingenuous if the language / words that are words that you would not normally use. For example, she's saying swapping out glucose for blood sugar or sugars.
Yes, so I think that it would be advantageous to use their words for that, for being culturally aware. Yes, I absolutely do think that that would be helpful to use their words.
Okay, thanks. And because I did have a question about that, and I figured it, but I noticed there's something on there about avoid idioms and jargon, and sometimes if you're using word sugars or blood sugars or something, if there might be a little bit of a chance to, I don't know, educate or give them the correct word, how to use it so that they're familiar with it. So I was just wondering how you would actually handle that. Thanks.
Absolutely. And yes, so I would say that you could use their language, and it would be a good opportunity to educate. Going back to the thesaurus of plain language materials, that could be one way to help educate your patients on kind of being on the same page of what they're trying to, what you're trying to communicate with them. So if your patient is using words that you don't necessarily use when communicating with them, I would make sure first that you're on the same page. Like when you say this, this is what you mean. And then you could tell them, this is the type of plain language materials you could use. So I would say, thank you, April. So essentially my answer is meet them where they are, and then you can build upon that. But yeah.
Thank you.
I hope that answered your question.
Yes, you did. That was great. It gave me a better idea of how to do that. Yeah, you did answer it. Thank you.
Sure. Thank you. Thank you for the question. So, and we were talking about idioms and jargons, and we just want to make sure that when we're talking about that, We don't want to use especially American idioms and jargons like phrases like needle in a haystack or hit the ground running, because when taken literally, they don't really make sense. We also want to be able to have access to high quality translators or interpreters if you can. And you want the translators to be able to translate the meaning of the message and not just the literal words. And you always want to avoid stereotypes and not make assumptions. You want to attempt to understand rather than assume. And again, you can use visuals and examples that reflect your audience. If you're using visuals in written communication materials, you want to engage people, not alienate them. And you want to make sure that the visuals don't alienate your audience by showing them only people that don't look like them. So you can see the example here. We have a patient in a hijab and different things. So it makes it more inclusive. And lastly, a good resource that you can utilize is Ethnomed, which is a tool to improve cross-cultural communication and raise awareness of different cultures. It contains medical and cultural information about immigrant and refugee groups. Originally, Ethnomed was designed to be used in clinics by care providers in the few minutes before seeing a patient. But as the popularity grew, the reach of Ethnomed has expanded beyond the clinical community, and it's now a useful tool for really anyone wanting to learn about different cultures. And you can search the website by using the clinical topic or by cultural group, clicking on links on the top of the menu bar, and there's a wealth of information. You'll see different sections, a cultural overview, learning about the country of origin, history, politics. There talks about postpartum practices, child rearing, gender roles, food and nutrition, religious practices, concepts of health and disease, traditional medical practices, and common acculturation issues, depending on what groups you're looking at. And there are also recommendations for how to assist refugees and a list of specific resources for each group. And if you work with people from other cultures than your own, or you're creating communication materials for people from different cultures, it's a really great website worth exploring. So I have my summary here. So we discussed health literacy as a way for an individual to obtain, communicate, and process and understand basic health information so they can make informed decisions about their health. The ways that you can evaluate a source is using the CRAP test, which is currency, relevance, authority, accuracy, and purpose. We also discussed universal precautions for health literacy to make sure that we communicate in a way that everyone can understand. The benefits of using plain language materials to limiting need to know information and being able to confirm understanding, and being aware of cultural differences that contribute to effective and clear health communication. I discussed free online resources that you can use, such as Medline Plus and Ethnomed, and I would be happy to either do a tutorial of Medline Plus or answer more questions if there are any. And I will just provide my contact information as well if anyone has questions and they would rather email me.
So we've got a few minutes here before our ending. I want to say on behalf, I know when you're sharing your screen, Kiara, you can't always see what's in the chat, but you've got a lot of comments about how useful these resources are. I've been trying, as you've been going along, to share some of the links to some of the websites you mentioned for folks. So I want to say on behalf of the Creighton University at Highlander team, like how useful this is and how helpful this kind of conversation is as we are doing our work. Dr. Costanzo, do you have any questions or closing sort of thank yous as we sort of wait for folks to prime their questions in the chat?
Sure.
Out loud?
Yeah, well, Kiara, I want to thank you again. And I I myself, I've worked in healthcare for a long time, over 40 years, and these resources are fantastic. So I really appreciate that. I have a question in general, since have you had a fair amount of opportunity to introduce yourself and present or be available for students, especially in the health sciences professions as well as the MPH program? Have you had some opportunities? And even Andre, in your area, I could see with the programs that you run too, some of this information is so valuable. What are some of the things that you've been involved in, Kiara, in the last few months?
So in the last few months, the presentations I have been involved in, I've worked with the CPPHE group doing a presentation on health literacy for them. I had a weird message. Just looked like other things that I've been involved in are more so getting like materials translated for different groups in the community. The Porto Clinic has a health information kiosk that has Medline Plus accessible on it, and patients can also email themselves information through there.
So Kiara, I think I accidentally stopped your video. I was trying to stop your sharing so people could see your face.
Oh,
and I think
sorry.
I stopped your video.
I'll stop my share.
So you might have to restart your video.
Oh, pardon me. I saw that come up and
yeah, I was trying to like so people could see.
No, pardon me. I
Sorry
saw
about
that come up and I didn't even really pay attention to it. Sorry. But yeah, so I've had some good presentations and some good good outreach going on. And I think now that spring's coming, it's been more of an uptick. I know with COVID and everybody kind of just trying to figure out how you do this and make it efficient. It's kind of an uphill battle initially, but I've had some really good responses and worked with some really good groups so far, and hopefully I can continue to build those partnerships.
Absolutely. This has been great. Thank you.
Oh, you're welcome. It's my pleasure. I'm happy to do it.
So I really appreciate.
Thank you.
Yeah.
Oh, you're welcome. You're welcome.
I really appreciate the crap. It's a good sort of learning tool for thinking about how to make sense about how to share information, because I think often I hear, and at least I can speak for myself as an academic, you get so excited about all of the things that we know that we want to sort of put it all out there. And I find that even with my own family, as I've gone and gone with them to appointments or tried to get them ready when they've gotten a diagnosis, to try to think about things that I'm one of those people who wants to find out everything. And I'll tell them about the one study that had like 5 people that, you know, their toes fell off or something, you know, and that's just not what they want to do.
Right.
So this is also a useful tool, at least for me personally, thinking about helping my family as they navigate like the vaccines and some of the other things that are going on. Like they probably don't need to know little teeny tiny bits of information.
Right. Yeah, it's very easy to want to just. I'm the kitchen sink type of person. I want to just like give you everything, and it's like that's not always needed. Sometimes it's not especially helpful. So it's like, how can I parse that out to give you the most relevant information that's going to be useful for you? So, yeah.
From your presentations, have you gotten a lot of comments about digital health literacy and the intersection with COVID-19 and that information and vaccine information?
Not a lot, but, and I think digital health literacy, even though it's important, I do think even through NNLM, it's one of those things that we're starting to really focus on. And there's even webinars and classes that they're developing that focus specifically on digital health literacy. And I know that they're going to be doing website updates soon, and the health literacy requirements that will be included on there. So that's definitely we're getting there. So
I have a quick question. I was just basically had a question about, and it's along the same vein, but not really, but like the visually impaired population, deaf and mute. What resources are out there, if you know of any, to kind of address that population when it comes to? I know sometimes there's individuals that help, through family members or maybe coordinated through an organization, but sometimes I have a hard time identifying local resources for those two populations. Do you have any information about that?
So April, your sound cut out a little bit. Could you repeat part of that? What groups are you looking at for resources?
Okay, can you hear me now?
Yeah.
A little bit better? Okay, my internet's a little bit unstable here today, but it's along the same lines, but not really, but I was trying to find out what resources are available for the visually impaired community and the hard of hearing deaf community. I usually try and reach out, but I don't really see that many resources here locally, and I was wondering if you might have some direction for that, and then what's available so that it's easily accessible and digestible for those populations.
Sure, absolutely. I would actually, April, if you don't mind, I would like to do some more research on that. And if you have, if you could provide your email or just send me an email, I can look into that further for you.
Okay, that'd be great.
What resources are out there?
Okay, no, I know it wasn't along the lines of what you were talking about today, but I was just wondering if you might have that, and if you do have any, I'd really appreciate you sending it to me.
Yeah, absolutely. Yeah, just contact me and I'll get you some info. See what I can find out.
Thank you.
You're welcome. Just making a note. All right. I don't know if there's
So yeah, I'll ask one more to get us going. I think that one of the questions I wondered a bit about as we've been thinking about this, because one of the things you talked about early on in your talk is about sort of health disparities and folks who are low income, and then also with ethnomed you talked about different cultures and how they. So I guess I was wondering if, like, as we think about communicating information to folks who may be new to participating in the healthcare system altogether, right? So maybe they didn't have a medical home, or they were from a country that, sort of assigned you a physician. Are there resources or ways to talk about, like, just sort of like what a medical home is, like what's the primary care versus emergency versus urgent care, because I know that can be also something that's hard for folks to navigate when, let's say, you're out in the community and you're doing a presentation and they think, okay, I'm inspired by this, maybe I should see someone, but not quite sure where they need to go. Is there any resource out there like that?
So you're looking kind of like where they can start, information of where they can start. Yes, so I think one of the resources is ethnomed. To start. Another resource is just depending on local organizations that you could reach out to, depending on what community, like let's say maybe it's a Sudanese community, reaching out to the local Sudanese organizations that help get Sudanese refugees kind of set up. That would be a good resource. I'm trying to think of other resources that are just like readily available online that you could just kind of get a starting point. And that's something, Dr. Johnson, that I will look into more for you too.
Okay. So. I mean, I say that I remember when I lived in Mizzou, and we worked with the Islamic Center there. That was one of the questions that came up a lot was, and I think we kind of just made our own thing, like, what's the difference between primary care, urgent care, emergency, like when you should use them, because folks were using them ER as primary care, and we were like, well, actually there's a system where if you go to this one doctor, he can still share your information, you know, like if you see some, you know.
Right. Yeah.
And so I found myself trying to find ways to explain that to folks who maybe that wasn't their experience where they had gone, where they lived before, or it had been so long because they had been in a refugee camp or somewhere that they needed to sort of get reacclimated to healthcare in general. Maybe they had it back home, and then, you know, there's a window of a year or so where they're in the camps and kind of care is just kind of scattershot, and then now they're trying to figure out how to navigate and get into a system again.
Yeah. Yeah. I know with NNLM, we do have community resources available, but because we're going into a new contract period, so they're kind of revamping everything, the lists that I had of resources that are available have been kind of sunsetted and being migrated into different places. So I can definitely get you more information about that once everything kind of gets more set in stone. But I'll look locally and see also what other resources we have for that, Dr. Johnson.
No, I mean, and that's part of it. We're all kind of learning together. This journey is changing. COVID has changed the way we practice public health and community health.
Right.
So I think everyone would have a kind of answer like that for a lot of these questions. But if there aren't other questions, again, I want to say how grateful I am for you who came, and those of you who are watching later. If you came in a little bit late, we are recording and we'll be uploading it to our Highlander website, the recording at some point in the next week. So be on the lookout for that. So you can certainly share. In your email, you should see an email from me, well, from the Highlander, asking you to participate in the survey, just to give us feedback or give us ideas for further sessions. That email had all the links that were in the chat, just in case you missed one. So you can go back to them, like the Ethnomed and the pictograph one. They were all in that email as well. I also in that email attached the flyer for our next 2 events in May. We have one of our mindfulness events. And then also we're working with well-being partners, talking about physical activity, how to encourage folks, you know, now that the summer is coming, to be involved with their families and their communities around physical activity. We're really excited about that. That's Cinco de Mayo. And then I think the meditation is May 7th. So be sure to share that information, and we'll send out a Highlander email with that in there again. But just thought I would attach it to for those who are already here. We're super grateful for the timely, helpful presentation you did, Kiara, and hope that we can work again with you as the Highlander group, but also perhaps also with some of the other health sciencey and community engaged groups on campus that really need this kind of help for thinking about incorporating these principles into the work that they are going to be doing during and post-COVID. So thank you.
You're welcome. Thank you for having me.
Thank you.
Thank you all for coming. And I have everybody's email address, Kiara. So if you need to try to follow up with somebody and you don't know how to get a hold of them, I'm happy to share it with you. I can send it to you and you can respond to April or me or whoever. So
Fantastic.
No worries about that.
Awesome. Thank you.
And I want to thank LaShawn for all of wonderful introduction and putting together these programs. This has been great, LaShawn. Thank you so much.
Oh, thank you.
Do a great job. This is wonderful. Thanks for everyone for showing up. Andre, it's nice to see you.
Nice
I
to
see
see you
your
too.
name. I see your name all the time. So it's great to see you. Yeah.